Hi, I'm the Nurse Daily Dose. Welcome back to the channel. Today we're going to discuss cancer. Now, I have broken down this video into the basic biology of cancer, risk factors for cancer, early detection, signs and symptoms, diagnosis, and treatment. You can find the time stamps to each topic down in the description box below. Be sure to watch each section because there will be questions about this information on an upcoming quiz. Let's get started. Cancer is not a single disease, but a large group of diseases characterized by a fundamental breakdown in the normal control of cell growth and division. It is one of the leading causes of death worldwide, accounting for nearly 10 million deaths in 2020. So let's take a deeper look at the basic biology of cancer. Our bodies are made up of trillions of cells that normally grow, divide, and die in an orderly fashion. This process is tightly regulated by our genes. Genes are segments of DNA that carry the instructions for making proteins and other molecules that determine how our cells function. Cancer arises when this orderly process breaks down due to changes or mutations in a cell's DNA. Any one of the estimated 20 trillion cells in your body can undergo these mutations, but it usually takes several mutations occurring in the same cell before that cell becomes cancerous. These mutations can be caused by a variety of factors, including environmental factors, viruses, genetics, or random mistakes that happen as cells divide. If a cell does sustain damage to its DNA, it may trigger that cell to repair itself or even trigger apoptosis, also known as programmed cell death. If a cell does manage to divide despite having damaged DNA, the resulting daughter cells will likely be abnormal in some way. Abnormal cells divide, they form tumors, which are masses of abnormal cells. Not all tumors are cancerous. In fact, many of us have probably had benign or non-cancerous tumors that were felt as small lumps in the colon. Benign tumors stay localized and do not spread to other parts of the body. However, if left untreated, malignant or cancerous tumors can break away from the original mass, travel through the bloodstream or lymphatic system, and form new tumors in other parts of the body. This spreading process is called metastasis. Metastasis is what makes many cancers so deadly. Let's go over some of the things that can cause these mutations. First, environmental factors. So, exposure to certain carcinogens, which are cancer-causing agents, can play a major role. Tobacco smoke contains more than 60 known carcinogens, so smoking or secondhand smoke can lead to various cancers, including lung, throat, mouth, tongue, and even pancreatic cancer. Sunlight is another environmental factor that contains ultraviolet radiation, which can damage DNA. Excessive exposure to UV radiation, especially from tanning beds, significantly increases the risk of skin cancer. Certain chemicals, such as those found in asbestos, can also cause cancer when inhaled, as seen in the development of mesothelioma. Next is viruses. Certain viruses have been linked to several types of cancer. For example, human papillomavirus, or HPV, is a common sexually transmitted infection that can cause cervical, anal, vaginal, vulva, penile, and throat cancers. Then we have genetics. Some people inherit mutated versions of genes that put them at a higher risk of developing cancer. And last, random mistakes. And we mentioned earlier that mutations can occur randomly during normal cell division. Over time, these mistakes can accumulate and potentially lead to cancer. The older we get, the more likely it is that these errors will occur and go unchecked, which is one reason why the risk of cancer tends to increase with age. Okay, so next let's talk about the different types of cancer. As we mentioned, there are over 100 different types of cancer. Cancer is classified based on where it originates in the body and the type of cell that it starts in. Here are the main types of cancer. Carcinomas are the most common type of cancer. These cancers begin in the epithelial cells that line the surfaces of organs and the skin. Epithelial cells make up the outer layer of skin, the lining of the digestive tract, the respiratory system, and many other organs. Examples of carcinomas include breast cancer, lung cancer, colon cancer, prostate cancer, and skin cancer. Sarcomas start in bone, cartilage, fat, muscle, or other connective tissues. Some examples include osteosarcoma, which begins in bone, and liposarcoma, which originates in fat cells. Leukemias are often called blood cancers, and they begin in the blood-forming tissue of the bone marrow. These cancers lead to a rapid overproduction of abnormal blood cells. The abnormal cells crowd out healthy blood cells, affecting the body's ability to fight infections, transport oxygen, and to clot. Lymphomas begin in the lymphatic system, which is part of the body's immune system. Hodgkin lymphoma and non-Hodgkin lymphoma are the two main types. Okay, now let's talk about early detection, signs, and symptoms of cancer. Early detection of cancer is crucial for improving the chances of successful treatment and survival. Many cancers don't show any symptoms in their early stages. That's why regular screenings and checkups are so important, even when you feel fine. Some cancers have specific screening tests that can detect them early. For example, breast cancer can be screened through mammograms and clinical breast exams. Cervical cancer can be detected through pap smears. And colorectal cancer can be found through colonoscopies. During these screenings, abnormal cells can be found and removed before they become cancerous. Be sure to talk to your healthcare provider about recommended screenings based on your individual risk factors and family history. Common signs and symptoms of cancer include unexplained weight loss, a lump or swelling in the breast or elsewhere that wasn't caused by an injury, abnormal vaginal bleeding, changes in urination or having dark yellow or bloody urine, unusual tiredness or fatigue, unexplained fever, recent and sudden changes in appetite, a change in bowel habits or chronic constipation or diarrhea. So if you notice any of these symptoms, be sure to talk to your healthcare provider. These symptoms don't necessarily mean you have cancer, but it is important to rule it out, okay? Now let's talk about diagnosis and treatment of cancer. Cancer is usually diagnosed through a combination of tests and procedures. The first step is usually a physical exam. Your provider will feel for lumps or other abnormalities. Imaging tests such as CT scans, magnetic resonance imaging, MRI, and X-rays can help visualize the inside of the body to see if there are any abnormalities. A biopsy, which involves taking a small sample of tissue for examination under a microscope, is the definitive way to diagnose cancer. Treatment plans are highly individualized and depend on the type of cancer, its stage, or how far it has spread, and the patient's overall health and personal preferences. Common treatments include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Surgery is often the primary treatment for many cancers. It is used to remove the tumor and surrounding healthy tissue. Chemotherapy uses medications that kill rapidly dividing cells, including cancer cells. It can be administered intravenously, orally, in pill form, or in some cases, it can be applied directly to the tumor site. Radiation therapy uses high-energy rays to destroy cancer cells. It can be delivered externally using machines that aim beams of radiation at the tumor site, or it can be delivered internally by placing radioactive materials near or inside the tumor. Targeted therapy is a newer approach that uses drugs that target specific genetic and molecular changes that drive the growth and survival of cancer cells. This helps to reduce side effects because it focuses on the cancer cells rather than just rapidly dividing cells in general. Immunotherapy is another newer treatment approach that helps the body's own immune system fight cancer. There are several types of immunotherapy, including checkpoint inhibitors, T-cell transfer therapy, and cancer vaccines. If you want to learn more about these treatment options, let me know, and I will make a separate video about them. All right, thanks for watching. I hope you enjoyed this video. If you did, please give it a thumbs up, subscribe to the channel, and hit that bell notification button. Check out my medical terminology flashcards, and be sure to follow me on social media. The Nurse Daily Dose. Again, thanks for watching, and I'll see you next time.